Welcome to What is Black, a podcast centering the stories of Black people and culture to help raise affirmed, empowered, healthy, and thriving Black children and teens. Hi, everyone, and welcome to another episode of What is Black podcast. I am so excited again to be joined on this episode by Dr. Jasmine Zapata, who is the Chief Medical Officer and State Epidemiologist for Community Health at the Wisconsin Department of Health Services. So she's everything. And she's joining us to discuss COVID-19, racial and health disparities as they relate to the virus, and how the virus has put a spotlight on how these disparities have developed, but also, where we are now. So I'm so happy to welcome Dr. Zapata. Welcome to the show today.
Thank you so much for having me, and thank you for hosting this platform. You're doing some amazing things.
Early this year, I had two other fellow pediatricians, colleagues of ours who are in public health, Dr. Lauren Smith, the Chief Health Equity and Strategy Officer of the CDC Foundation, and Dr. Letitia DeRosa, who's the Commissioner of Health for the Baltimore City Health Department, talked to us about COVID-19. And I'm happy that we can continue the conversation given all the updates. And, it's been an interesting 2 years, right?
Mm-hmm.
Since COVID first started. So first and foremost, I wanted to find out how you're doing and how is the family doing?
Oh, thanks for asking that question. And that's so important because especially as frontline healthcare workers and public health leaders, it can definitely be exhausting. So my family and me and my family are definitely doing well. It's been a long, rough year, but we're doing well. We had COVID actually the month before the vaccines ever came out. So, about a year ago, and that was definitely very, very hard. And it really made me have an increased passion for really getting out there and educating, having conversations about COVID. I was able to donate convalescent plasma, and it really increased my determination for fighting this pandemic in every way possible. I'm blessed that I am alive. There's so many people who are not able, who don't survive. So I really took it as a blessing that I even had the opportunity to still be here today to talk about it. And other than that, that was pretty scary. But we're doing very well. And we are working on practicing radical and intentional self-care. So I'm doing a ton of self-care activities that bring me joy and my family. And that's where I'm at now. Just happy to be here and hopeful.
Oh, awesome. And I think that's so important, and it makes it relatable, right? Because not only are you a physician and a public health official, right? You're also a mom, right? And all the things and frontline healthcare work, right? All those things that really come together for you to do what you're doing. So I was wondering if you could share a little bit more about your role and how you work to improve health of communities and families.
Yes. So in my role as a newborn nursery doctor at the hospital, I get the opportunity to run to slightly high risk deliveries. We do resuscitation for babies. We do procedures, and then I get to round with new parents, telling them and talking with them about how to take care of their new baby. And if the baby has any health conditions, we help address those. And if needed, help to facilitate the transfer to the NICU. Well, there is a lot of education, a COVID-19 education that goes on because many of the families, of course, are already very cautious about bringing their little babies home, but they're asking about how can we stay safe? Many of them are facing different economic challenges as a result of the pandemic, emotional challenges as a result of the pandemic. And so there's a lot of work that goes on in the newborn nursery because even in the midst of a pandemic, even if other surgeries or clinics were canceled, you can't stop babies being born. So that's been one way that I'm able to work in this area. Also, I do a lot of health education and talking about social determinants of health with our medical students at our UW School of Medicine and Public Health. One of the classes that I am one of the co-instructors for is a class about communicating public health information to the media and to legislators. So I love going and talking with the future medicine and public health leaders about that, because now more than ever, one of the biggest threats as we are fighting this pandemic is misinformation. So we are training up an amazing army of public health leaders, medicine and public health leaders, who are going to be able to write letters to the editor, do social media campaigns, and talk with their legislators. And so that's something I'm very excited about, just working with future working with medical students and masters in public health students. And then in my role as Chief Medical Officer for Community Health at the Wisconsin Department of Health Services, I serve in a variety of roles, but one of them is I am co-chair of the Maternal Mortality Review Team, and we review all of the deaths of pregnant people who died during pregnancy or within a year of pregnancy. And in that role is so important because we are able to look at autopsy records, hospital records, able to look at police records, to really look and see how could this death have been prevented? Was it preventable? And then we use those recommendations to try to save future lives. And now, especially now that we are in a COVID-19 pandemic, we are starting to review the deaths that started in 2020 related to the pandemic. And so, as we know, when you are pregnant, you're even more susceptible to complications from infections. And so that is a really awesome role to be in, to figure out ways that we can prevent future deaths, address social determinants of health. But now on top of that, we're starting to look at the COVID-related deaths, pregnancy deaths, and I get to play a role in that, which I really love. And I'm doing a ton of community conversations and outreach, helping to spread the word about now that children are able to be vaccinated 5 to 11, going out to talk to schools and with teachers, and that has been really amazing. And then finally, I am the co-chair of our Governor's Health Equity Council Subcommittee on Power, Access, and Representation. And in that role, we are working on ways to achieve health equity by the year 2030. We're submitting a list of recommendations for the governor to consider adopting that will help achieve health equity. And that the subcommittee on power, access, and representation is just so important, because we need to have represented in medicine, in government, in schools, in every single area, people who are the most impacted. We talk about health equity all the time, but the people whose voices should be the loudest and should be listened to the most are those most impacted. But I'll stop there. I do a lot, but those are just some of the things that I've been doing in the midst of the pandemic.
So you're doing great work. Because I think, and I think what I love about this platform is I get to interview, friends and colleagues, right, who are Black doctors,
yes,
leaders in their field, right? And hopefully, right, when people say that, oh, I don't see someone reflecting me, that representation, right? Yeah. I mean, there can be definitely we need to increase the pipeline, right, of women of color,
yes,
entering the medical field, but
yes,
we're here, right, and we're doing the mentoring and we're representing. So I love that, and I love the fact that your health equity work, right, the intent of not just being in DEI work, diversity, equity, and inclusion, right, is power, access, and I forget the last part,
and representation,
right. So to me, that really reframes everything, right. It takes it out of just having, oh, do we have a Black person, Hispanic person, a woman, right? It goes beyond that, which I think is wonderful.
Shifting power is so important. Instead of just having large institutions or certain bodies holding economic power or even political power, we need to find ways where we can shift, rather than just giving handouts. How can we shift that power into our communities? And that's something that I'm very interested in, and is so important to me.
Awesome. All right. So we're going to start talking a little bit about COVID. So I wanted to talk a little bit more about how you and the work that you're doing, working with the health department, how you all are addressing COVID-19, the racial health disparities that are occurring as a result of COVID-19.
Yes, that is a great question. So, one of the biggest things that we're working on here at Department of Health Services is focusing on having community conversations, but also when we're talking about having people feel comfortable with getting the vaccine, is partnering with trusted messengers. Again, partnering with trusted messengers. It's not enough just to come in in my white coat and say, because I'm a doctor, this is what I'm telling you, or because we are a state authority, we're telling you to do this. That doesn't work for everybody. In order to trust someone, you have to know that they are reliable, that they've been there in the past and they're going to be there in the future. You need to know they're reliable. You need to know that they're credible and know what they're talking about. But you also have to feel safe with them emotionally, having these conversations. So it's not enough to just have credibility and authority. You also have to be reliable and have those deeper connections that people really feel safe and comfortable talking with you. So some of the best ways that we have been working very diligently on is partnering with trusted messengers and to get the word out about the vaccine, just general COVID prevention, information out on how to take care of your more emotional and mental well-being. Combating some of the various economic hardships related to the pandemic. So one thing we did, I was very proud of at Wisconsin Department of Health Services, is we had a vaccine equity and community outreach grant program very early in the pandemic, and still ongoing. And it was about $6.2 million that was given directly to community groups and organizations to partner. So that was a way to partner with trusted messengers to be able to hold community vaccine clinics, community education, and providing resources to families who need it most. So that's one thing. That's just one example. Partnering with trusted messengers, and a lot of collaboration has been what we have been working on. I've been loving going to churches, parades, schools. I've been all over the place, a couple places in person and virtually, having conversations, and that's what we're all about here at DHS.
So would you say then? I mean, I know like COVID has been has devastated a lot, right? But there's also been opportunities, right, with COVID, and I think especially on the systems level, right, rethinking how we address the needs of all the community, right? Because I think again, COVID has really shown or highlighted, right? There are, we talk about disparities, right?
Yeah.
But the question is, why the disparities exist, right? It's not just because of race. It's not just because someone is this racial classification. They're already, predestined to have these poor outcomes, right?
Yeah.
We're finding, like you talked about social determinants of health. And I was wondering if you could talk a little bit more about that, but how, like, for example, examples that your health department is learning from what COVID has kind of shown, right? Making something positive out of, some of the negatives that have occurred with COVID.
So some of the lessons that we've been learning is so important. Kind of as I was mentioned earlier about trusted messengers, it's so important to develop relationships with our healthcare partners in the community, individuals. Developing relationships and fostering those is so important. It's going to help us get through our current pandemic, but it's going to help us for the future. And we're also learning that when we talk about issues of health inequity, we cannot be reactive just because we saw, oh man, there's disparities and inequities in hospitalization and death rates among different races. We can't just be reactive. We need to embed prevention efforts into our very structure. So because of that, because of some of those lessons that we learned, it's important to be very proactive and systematic about it. Instead of being reactive, we, over the course of the pandemic, created an Office of Health Equity. The Office of Health Equity sits at the highest level of our department. And it's going to be a continuous way to continue to work on some of these issues. And the main focus of the Office of Health Equity is to integrate a health equity lens throughout all of the Department of Health Services for our internal workforce and external initiatives, partners, and policies. And we just last month announced the new director of the Office of Health Equity for Department of Health Services, and that's Dr. Michelle Robinson. And she is just absolutely fabulous and amazing. And she is hiring a lot of new staff and putting forth her plans and visions. So it's such an honor to work with her. Currently, she's the co-chair of the Governor's Health Equity Council, and she does a lot of work in Department of Children and Families and all over the state. She's already doing great work. So we're just so honored that she's going to come to DHS to lead the Office of Health Equity.
That's awesome. And I'm hearing, locally, here in Maryland, I think similar strategies are being implemented, right? Because I think I think there's been an understanding that the old way of doing things, right? I mean, they worked for what they worked for, but we need to do more, right? And I think, especially with COVID, funding is helping, I think, be able to sort of create those opportunities, but also those lessons learned, like you said, it's really changing systems, right? How we approach and how we engage with our communities, which is so important.
Yes.
So doing great work. So you talked a little bit about some of that community engagement, right? Going to churches and schools. And I wanted to talk a little bit more about, again, some of the updates, at this time a few weeks ago, the FDA, CDC, approved the vaccinations for children 5 to 11, and wondering like how that communication is going to parents who probably have lots of questions, and even their other caregivers, and how that's going to try to again, that's an equity issue as well, right? How do we get younger people to also be vaccinated?
Yes, that is a great question. And so it's definitely ongoing conversations, even for parents who have been vaccinated. It's different regionally, but there's a significant portion of even parents who are vaccinated, of them who are still questioning and deciding about if they're going to get their children vaccinated. And then there's a large portion of them that had their kids first in line. But with that being said, there's still, as you mentioned, a lot of questions about this. But the strategies that we've been taking is, even before the approval occurred, just over the last several months, we've been beginning to plant seeds and have forums and conversations about this, and build relationships with schools. A lot of the initial relationships with schools were related to mask mandates and testing protocols. But because we've already been able to establish those relationships, now that the vaccine has been approved, particularly for ages 5 through 11, it's very easy transition to now start to have those conversations. In fact, next week, I'm going to be on a joint call with our state Department of Public Instruction and then our Department of Health Services as a joint webinar for families and for school officials, just to address many of the concerns that parents have, and really talk about this in a way that people can feel comfortable making the best decision for their family. So lots of conversations, lots of supporting, and really normalizing getting the vaccine.
I think that's so important, because it sounds like, the strategy, right, really is, there's a it's a consistent strategy, right? So whatever community you're engaging with, you're making sure that you have, who are the key stakeholders, right? Who are the key people that need to be involved in the conversation and communication. And it sounds like it's also like a back and forth conversation, which I think is important.
Yes. It's important to have back and forth conversations, not just, public health shouldn't just be going around telling people what to do. It definitely should be a conversation, giving people education, but also validating their concerns and building relationships, having conversations so that everyone can go forth and make the best decision for them.
I'm so excited about, I think, this opportunity. Again, I mean, it's not fun to have COVID, right? But I think there are opportunities now for people to really understand what public health is doing and how they prevent, right? Because I think for the most part, right, years ago when I was in public health, the saying was, public health is working when you don't even have to hear about us, right?
Right.
But in some ways, I think that that worked to our detriment in a way, right? Because then it's like, well, all right, everything's going fine, but you don't know, you don't see what's going on to make it fine, right? All the people that are working hard, the health officers, the chief medical officers, right? The nurses, multidisciplinary staff that are really working to, prevent disease and protect the community. And I love the fact now that, we're giving face to, people who are working hard, right? They have families in the community. They're entrenched in the community.
Yes.
They have a stake in not only the community, but, for themselves, but also the community, and working collaboratively, which I think, like, yeah, I definitely want to say, thank you for all the hard work, that you're doing.
Yes, thank you so much. And one of the reasons why I even got into this role, because there were periods of time where I told myself, like, I would never go into public health. I'm not going to do that. I'm a doctor in the hospital. But then when you start to see in your own life, your own birth outcomes impacted, your own friends and family getting shot due to gun or and dying due to gun violence, your own family in poverty or racially profiled, or just inequities in the criminal justice system. When that hits you, your own friends and family and the people that you interact with, then it doesn't become the community and me. It's like, I am the community. I had to come into the field of public health to fight for myself, my family, and those around me that I consider colleagues and extended family. So that's how I got into the field of public health, to really change in a radical way some of the social determinants of health that are significantly impacting us every single day.
I mean, a few times on the podcast, I have talked about, so I have, social determinants of health have come up. And I was wondering if you could explain to listeners a little bit more about what you mean by social determinants of health, just so that we're level setting everyone.
Of course. I love that. I love that. So social determinants of health, there's many different ways that people can define that. But one of a broad way that I love is social determinants of health. It means, the things that impact your health that are related to where you work, where you worship, where you play, how much money you make. It's the things that are outside of just your individual choices that impact your length of life and your quality of life. So I'll give another example. According to County Health Rankings model by our Population Health Institute here in Wisconsin, their model shows that about only 20% of health outcomes, as it relates to your length of life and quality of life, only about 20% is based on what happens in the hospital and clinics. Now, I spent over 20 years going through medical school, going through tests, out of a lot of money to become a doctor. And when I came and I saw, and I was getting my public health training, and I saw that slide, I was just mad at first. Like, you mean to tell me I spent all these years of my life to be in the hospital, in which I thought as a doctor, that's the highest level of a way that I can impact people. And it's only impacting about 20% of our health outcomes. The other 80% is based on your health behaviors, but it's also based on your social and economic factors, your environment. So 80% is based on things that don't even have to do anything with medicines prescribed, diagnostic tests, or things that happen in the hospital and clinic. So if we want to have a true impact, we can't just talk about the COVID vaccine shot. That's it. That's something that is like a medical intervention. That's not what's going to undo many of the inequities that we see. In the same conversation about getting vaccines and everybody want to go get vaccinated and wash your hands, we need to talk about, okay, let's take a pause. Why, when I get pulled over, me and my husband get pulled over by the police. Are we having panic attacks? And we didn't even do anything wrong because we're worried about how we might get treated, or are we going to make it out of this encounter? Why in Wisconsin, for example, does a Black man who does not have any felonies on his record get less job offers than a white man with a felony on his record? Why is that the case? Why are there inequities in sentencing for two men, one man of color and a white man that both have the same amount of drugs caught with? Why is there disparate sentencing with that? Why in Wisconsin there's less than 10% Black population, but that makes up over 50% of those who are incarcerated? Why are we seeing such inequities in home ownership rates and college graduation and high school graduation rates even? If we're going to talk about one's length of life and quality of life, and also overcoming this pandemic, in those same conversations, we need to talk about the very things that impact health in radical ways that are outside of traditional medicine. And so that's a long way to say I'll get fired up. I could talk about it all day, but that's what social determinants of health is. What happens when that person goes home from the clinic and the hospital?
Yeah. I think that was a great explanation. I think one of the best explanations I've heard about social determinants of health. But it's interesting, when you talk about the social determinants of health, right? The things that you were also alluding to, right? Structural racism.
Yes.
Right, being really an underpinning and one of the root causes for the outcomes, right? Poor outcomes for certain communities, Black communities, Hispanic communities, and Asian. And then also too, like if you do a breakdown, right? And I think we're getting better with that, or I think we're going to start to get better with how we disaggregate data, right? So how we break down groups of people and not just as monoliths, right? Oh, all the Black people have this data and all the Hispanic people are Asian American or indigenous.
Right.
It's like, where do zip codes and where people live and all those other things that really are impacting. So I think that's going to be important. I mean, maybe people don't care about the numbers, but it does matter, right? The data matters.
Yeah, I totally agree.
You're an epidemiologist.
Yeah, one of the hardest things that's so heartbreaking every time. I have tons of stories, but when I'm in the newborn nursery and then we have to, I tell the family all of my typical things about how to prevent infection, safe sleep for the baby. And then they're discharging to a homeless shelter or might not have anywhere to go. And that's heartbreaking, because how are you going to be able to follow all these guidelines and take care of your newborn baby when you're worried about, like, where are we even going to live? Are you going to really make it a priority to show up to that follow-up appointment that I want you to go to so we can check the baby's weight and see how feeding is going when you're going into a crisis situation? It's hard to focus on the things that we're telling you in the hospital and clinics if you don't have your basic needs met. That's heartbreaking every time that happens. But that, again, those experiences, you can either use them to get you depressed or burned out, or you can use them as fuel and motivation to fight for change. And so that's another example of social determinants of health and things that I get to work on as a chief medical officer within our department, to work on changing some of those very underlying system structures, systemic racism that impacts our patients.
So I agree, and I think again it kind of goes back to when we started the conversation about why there are these disparities, right? Why there's certain groups that have higher rates of COVID, or maybe certain groups that are not vaccinated at a higher rates compared to other groups, right? And again, how that communication, how you take all those factors into the communication to the communities that you want to outreach to, right? And so I guess I want to talk a little bit about that in terms of how you all think of, how does like public health in general think about how you communicate to particular communities? Is it again through those trusted communicators, trusted people, trusted stakeholders in the community that help you facilitate that?
Yeah, it's a combination of, yes, working alongside trusted messengers, and then also just being very careful in our language and communication, where you don't want to worsen a divide or push people away even more. Right now, we're seeing a lot of stigma, even through the media, with people who have not yet decided to get vaccinated, or that's the decision that they made for themselves. There's a lot of shaming or stigma, but we need to make sure that when we're engaging in conversations, as I mentioned, one of the biggest tenets of trust is making sure that person feels safe emotionally having that conversation. So we, in everything we do, try to acknowledge people's feelings, whether it's an underlying feeling of fear or questions that they still have, addressing that in a non-judgmental way, leading with love, letting people know that we're all in this together. This is a very scary situation that we're going through. We're all in it together. Here's some information that we have because we want the best for you. What questions can we answer? Where are you at? Let's have a conversation rather than just saying, you didn't get the vaccine, you're the reason for the pandemic, and you're going to die, and we're not going to care if you die. Like, those are some messages that I've really seen out there. And do you really think that's going to get people to trust you more? That's just going to make it even worse. So we're doing a lot of relationship building and a lot making sure not to be judgmental in these conversations that we're having.
So before we wind down, what would be your recommendations for families that want to learn more about the COVID vaccine? And also, I throw in there why it's also important to get the flu vaccine this season.
Yes, great question. I'll start with the flu vaccine question. Getting the flu vaccine is important because if you get the flu vaccine, it can significantly reduce your chances of getting the flu, but also your chances of hospitalization and death from the flu. And the flu impact, even though some people say I went years and I never got the vaccine, there are people every single year, adults and children, who get very sick, and some do die. And this is something that's preventable. So that's why it's very important to get the flu vaccine, because it can reduce the risk of infection, hospitalization, death. Also, it can prevent missed work and activities, as one of the things that people value the most, especially in the midst of this pandemic that we're living in, is getting to spend time with loved ones, getting out and doing some of the things that you couldn't do, especially over this holiday season. And you do not want to be homesick somewhere because you got the flu and miss out on some important events. So if anything, other than physical safe protection, for emotional protection as well. So you don't have to miss school, work, or really important, meaningful upcoming events. And as it relates to just general advice for families who are wanting to learn more about the vaccine, I would say wherever you're at, we're so excited that you are just open to this conversation. Just the fact that you're asking questions is good. One of the best people to talk to is your healthcare professional, especially if you have specific questions about like, what vaccine should I get? Or if I have this allergy, what should I do? If you have very specific questions or just general questions about vaccines, or vaccine safety, please call your healthcare provider, schedule an appointment. You can even talk to some of their nurses over the phone. Sometimes you can even send them an inbox message, and they can talk with you. You can also connect with your local or your state health departments. Usually you just do a Google search, whatever state you live in, whatever city you live in, your local health departments have a lot of information. And then continue to talk to people around you who you trust and love, just to talk about your feelings, see what other people did, and just continue having conversations and know we're all in this together.
And then my second to last question, you brought up, I think, really an important message, right? When you were talking about the vaccine and communication, mm-hmm. and you mentioned, even at the beginning, you talked about self-care, social emotional well-being, and how important that is as well, right? Because I think sometimes when we think about health, we forget about our mental health, right?
Yes.
And I wanted to have you have an opportunity to, again, kind of just really, really speak to that.
Yes, that is so, so important. Whew. There have been people who are losing parents, losing spouses, losing children. One death, even though we look a lot at statistics, and a lot of times people get numb to all these statistics, but we have to remember behind every single statistic, this is an actual life. This is actual families and communities being ripped apart, being devastated for just one death. I have to see death in my role as a doctor. I've seen it, and it's something you never want to have to do, to go tell a parent that your child has died. My own brother passed away many years ago, not from COVID, but from sudden unexpected death and epilepsy. And to the impact that it had on me, and even particularly my mother, because that was her only son. We're still facing the ripple effects of that today. And it's been over 10 years ago. And that's just one child that died. So imagine all the death that's happening right now across the globe with COVID-19 deaths. It is causing a lot of emotional turmoil. And so it's so important to take care of not only our physical health, but our emotional well-being and our spiritual well-being and our mental health. All of that is so important. We have been seeing increases in some areas and regions, increases in overdose deaths, increases of children feeling very anxious. In some parts of the nation, there has been upticks in youth who die by suicide. And so we really need to watch out for that, because especially as we get the vaccines rolling out, more herd immunity, and we start to get through the physical impacts of this pandemic, hopefully in the next couple months into the next year, we'll be seeing decreases in the COVID-19 numbers. But we need to watch out, because there's going to be there's potential increases in some of these long-term emotional and psychological impacts that are going to be a pandemic of its own. And we really need to be watching out for that. So some things that you could do just in your personal life is practice every single day in intentional joy. Figure out something once a day that you could do to just make yourself smile, have joy. Also, there's research that is emerging that is showing that when you stay connected to your sense of purpose, that actually reduces inflammation in your body. It changes certain structures in your brain, particularly your amygdala, the center of the brain that deals with fear. It helps you adapt to and overcome negative emotional situations, which the COVID pandemic definitely is. When you are connected to a sense of purpose, there's research studies emerging that it helps increase your length of life and quality of life. So especially now more than ever, practice joy intentionally every day, but remind yourself every day of your purpose. Do things that bring your life meaning. And those are just a few things that are helping me, but also that I'm sharing with everybody else so that we can all get through this together. I don't want us to just survive the pandemic because I made it. I'm physically alive, but I'm messed up in the head. No, you want to come out whole and healthy in all areas. So let me stop there, because I'll keep talking all day about that one. That one's very, very important. Take care of yourself.
Yeah, thank you. And again, thank you for being vulnerable and sharing your personal experiences.
Yes,
because I think they teach, right? There are opportunities to teach us, and I thank you. I honor you for that. And thank you again for joining us. Joining us today to share your joy. And I mean, I can tell you are passionate about public health, and that is so needed during this time.
Yes.
And I don't know if there's anything else you wanted to share, like maybe where people can learn more about you, or.
Oh, yeah, I would say, our website, our DHS website is, you just go to the Wisconsin Department of Health Services website, and I will send you the link as well. So maybe you could link it to this podcast and the YouTube videos. There's a lot of great information there about a lot of the things that we're working on. And so that's what I would say. That's a resource that's great to share. We're doing a lot of great things here, and I'm so honored and excited to have this space to chat. My last thing that I would say is everybody just stay encouraged. This has been so hard, but don't give up. Stay encouraged. Even if you're having a rough time, take one day at a time, 1 hour at a time, 1 minute at a time, 1 second at a time. Even if you just have to pause and breathe a couple seconds just to make it to the next minute, don't give up. Stay encouraged, and we are going to get through this. And I'll stop there.
Thank you so much again, Dr. Zapata. It's always wonderful to talk with you and to hear your joy. So thank you so much.
Thank you. Take care.
You too. Thanks for listening. Music and editing for this episode by Manny Simone. We want to grow our community, so please tell a friend about the podcast and let them know that they can subscribe to the podcast wherever they listen to podcasts. Check out our website at whatisblack.co to learn about our work and to sign up for our newsletter to stay up to date about our exciting projects like our upcoming documentary, Reading in Black, celebrating Black children's literature. Until next time, wishing you peace, wellness, and joy, and a reminder that you're seen and matter.